Hi students, welcome to HSC Biology and Module 8, Non-infectious disease and disorders. This is video number 17. We're looking at educational programs and disease prevention. In this particular one, as for many of the ones that we've looked at in this kind of group of epidemiological studies, you need to be able to use secondary sources to evaluate the effectiveness of disease prevention methods and develop strategies for the prevention of non-infectious diseases related specifically to educational programs and campaigns. Now, this is obviously a big area, and the expectation is that you'll be able to use data that you're given in an exam to be able to analyse specific impacts of things like educational programs and campaigns. So this is really one of those types of studies where we're actually looking at intervention. We're looking at whether or not the steps that we've taken have made any difference. So you need to obviously identify some of the current campaigns to try and assess those in terms of what they're trying to do, and perhaps to see if you can actually evaluate how successful they have been, or maybe how successful some of the campaigns in the past have been in actually creating change, and particularly change in relation to the incidence of certain types of disease. So while we look specifically at non-communicable diseases, and that's what we focused on a lot in this particular module, some of what we're talking about does also relate to infectious disease. So be aware that some of the strategies and some of the approaches that we look at in this particular section can be equally applied to infectious disease just as they are to non-infectious disease. But we are specifically looking in the, I think the theory behind it, or actually the focus of this particular outcome is for you to look at some different types of non-communicable diseases, NCDs. And the most common of these are cardiovascular disease, cancer, chronic respiratory diseases, and diabetes. So you can see we've got things that are related to diet, we've got things that maybe are related to environmental exposure, and that very much the case for cancers as well. And for cardiovascular diseases, very much factors that relate to lifestyle. And that's why these things are really important. Now, whilst the four major groups of NCDs account for over 80% of all NCD-related deaths, they do share four common risk factors. And so when we're doing our epidemiological studies, one of the things that we're always looking for are risk factors, increased likelihood that if you have one or several of these risk factors, you significantly increase the likelihood of developing one or other of these types of NCDs. And the four major risk factors for different types of NCDs shouldn't be difficult to guess because I flagged them in the previous slide. They are tobacco use, and this is something that has started to move from cigarettes to vapes. It's starting to become much more common. I saw some figures quoting around 600,000 Australians involved in vaping, and some of the laws in that are proposed to be changed, or at least tightened a little bit in relation to importation of liquid nicotine. Alcohol use is something that I'm sure you've heard advertisements about, and that doesn't just relate to excess alcohol. It also relates to things like operating machinery, such as driving cars when under the influence. Diet, of course, is one of the ones that we'll always be talking about, and also physical inactivity. And one of the things that's been noticed by a lot of people during the COVID lockdown times that we've had in New South Wales is that there's been an increase in this physical inactivity, and a lot of people have noticed they put on the COVID kilo or more, just as a result of change in lifestyle habits and perhaps slightly more sedentary behaviours than what we've had in the past. Educating the public. Well, that's what public health campaigns are all about. There's a really nice allegory that I think you can use to build around the whole purpose of education public health campaigns. And that is building barriers at the top of the cliff rather than sending the ambulances to the bottom. So what we want to try and do is see if there are ways where we can actually prevent people and or vehicles from going off the top of the cliff and then having to deal with the mess that's created as a result of that. If we can, rather than treat what's happened, if we can try and identify what may be the cause and see if there's things that we can put in place to actually help protect people, to act as kind of early warnings, to be able to intervene at an earlier stage so that people are a little bit more aware. There's costs associated with that, but the most expensive of all of those costs is the personal cost, particularly when that personal cost is a life cost. So I think this is one of the primary concerns and why we want to try and at least give people as much information as we can. And that's what science is about. Science is about evidence. It's about information. It's about trying to give people as much information as they can to make an informed decision. As I said, there are healthcare costs associated with health and disease. Governments spend large amounts of money. In Australia, we have Medicare. We also have a levy that's placed on our taxes, and a lot of Australians, particularly of a certain age, have health insurance, and often neither of those two things together can be sufficient to cover health costs. There's a gap, there's an additional cost over and above that as well for certain types of procedures, for certain types of people. So healthcare is massive. It's a big cost. It doesn't overcome the personal cost associated with the loss of life and health, but it is nonetheless significant. And there are welfare costs as well, as there are a lot of people who are not in a position to be able to afford things like extra private health cover, and so therefore reliant on government health. And of course, there's a lot of people in that situation, not just those who are of working age, but an increasing number of people in our population who have gone beyond their working lives and are now in retirement. So we're going to look at some of these different types of campaigns. I'm going to give you some examples of each of these anti-smoking campaigns, and there still are anti-smoking campaigns despite the fact there's a lot of laws associated with this now. Sun safety, we're getting sort of well into spring, moving into warmer weather, so we want to be outside more, we want to expose our skin to the sun more. We need to be aware of the issues associated with doing that. Responsible drinking, safe driving, good choices, yeah-nah campaigns, and also healthy eating. And these are all things that are a series of campaigns. You Google them, you'll find lots of YouTube clips, and you only have to sit in front of the TV for a short period of time and you'll see some of these campaigns. Are very important. Of course, COVID, getting your vaccine for COVID is another very important campaign at the moment, although that's obviously an infectious disease campaign. So we're going to evaluate them. What are we going to do? Well, our textbook, our Biology in Focus book, suggests that there's a few criteria that are important for you to kind of tick through as you're going through and looking at these, evaluating these particular types of programs. So is there an evidence base for specific action? So when we're going to tell the public about it, we need to have some good evidence behind it. Are there a limited number of high priority interventions? So we want to get bang for the buck. We want to make sure that we put our resources into something that's going to make the biggest difference. So we want high priority interventions, ones that are going to have a profound effect, and we don't want 20 of them. We want a small number just to tell people, do this, eat that, go there, don't do that, and that will be often sufficient. We want effective performance management, which is going to include monitoring, evaluation, and improvement. If we're going to be serious about our public health campaigns, we're going to need to make sure that we reflect on them regularly, we gather data, we see whether or not we're making a difference, and then we modify our approach if we're not having the impact that we would like to have. Often there will be partnerships between the private and the public sector for things like alcohol campaigns or reduced drinking campaigns. Obviously, that is going to affect part of the private sector because it is going to affect potentially revenues. And so, but overall, we want to make sure that there is an understanding of exactly what's going on. And of course, in some of the specifics related to some of these diseases, the history of those suggests that often those private sector businesses with something major to lose were also out there putting out information which wasn't necessarily helping the public. We want to make sure then that we're reporting accurately to health workers and the general public. So all of this information is available, it's public, but it's also something that is accessible by healthcare workers. And that is any doctor, any healthcare worker that you see, you can have access to that information. And obviously there needs to be some political commitments because there's costs associated with education campaigns, whether or not we roll them out as TV advertising or advertising in other media, or whether we roll them out into schools, into awareness raising campaigns in schools. There's going to be some sort of financial cost associated with this, and often it is state or federal governments that are going to meet some of those costs. So this is a nice little checklist for you to work through as you're looking at some different examples of educational campaigns in order to try and address some of the issues associated with certain types of disease. So we'll look at some of those in class. Thanks for watching.